Hey folks, on today's episode, we are talking with Dr. David John, who has been advocating for women, immigrants, people affected by HIV, and families for most of his life. Stay tuned. Hello folks, welcome to Season 9's Trini Corner, brought to you by our Consulate General of Trinidad and Tobago, NYC, Mr. J. Andre Laveau. I'm Ozzie Stewart, as you know, and grateful that you've tuned in. And this is my thank you tour where I'm giving flowers to Trinidadian impactors. So please like, share, follow, check our donate pages, our new member page, and be aware of our after show called Inside the Call. On this episode, I am so grateful to be sitting with Dr. David John. And with that, we're going to get into some questions. But before we do, you know what I like to do? I like to give a little bit of a wrap as to who my guests are. So here we go, and it's going to take a minute, so hang in there. Dr. David H.A. John is a distinguished Trinidadian healthcare professional based in Brooklyn, New York. He is currently serving as Director of Occupational Health and HIV Services at Gotham Health. He has been recognized for his outstanding achievements in adult preventive medicine, contributing to defining the overall business strategy and direction of the organization's 8 main centers of operations. He is a member of the American Academy of Family Physicians and has demonstrated leadership and inspiration to his medical colleagues throughout his career. His passion for providing the best medical care possible has led him to assist in the implementation of population health programs, including mental health and substance abuse screenings. After arriving in New York in 1980, Dr. John completed his residency at Catholic Medical Center and has been rated an average of 5.0 stars by his patients. He obtained his Bachelor of Science from the City University of New York and earned his medical degree with Weill Medical College of Cornell University. He then completed an internal medicine internship at North Shore University in Long Island and a family medicine residency in Brooklyn. Dr. John is board certified in family medicine by the American Board of Family Physicians and is also a certified physician in his home country with the Medical Board of Trinidad and Tobago. After working in New York for a few years, Dr. John decided to return to Trinidad in 1994 to contribute to his homeland. During his early years in Trinidad, his involvement as a faculty member in the Lutheran U.S. Caribbean HIV and AIDS Twinning Initiative contributed to the success of this program. He volunteered as a medical professional at the Cyril Ross Nursery, a home and treatment center for HIV-infected babies who were neglected and abandoned by their parents. His focus at the nursery was pain control and other comfort care, and he worked alongside fellow Trinidadian and Miss Universe of 1998, Wendy Fitzwilliam, to bring antiretroviral treatment to these children. Dr. John's dedication to providing care to HIV-infected children led him to become a board member of the Caribbean Women's Health Association in 2009, working tirelessly to advocate, address comprehensive education, healthcare disparities, improve healthcare access, and promote better resources for women's health in the Caribbean region while continuing to assist patients with HIV screening, housing, and other social services. Dr. John's commitment and advocacy to improving healthcare outcomes for underserved communities, particularly immigrants from impoverished backgrounds, such as the Dominican Republic and West Africa, has earned him recognition, praise, and honor with a special proclamation from the Mayor of New York City for his contributions to healthcare, for his dedication, leadership, and impact in the medical arena in Brooklyn, and for his dedication to addressing critical health issues, providing the highest level of medical care and promoting the health and wellness of the community he serves, was recognized by Continental Who's Who. Dr. John, here we go. What inspired you to become a medical volunteer at Cyril Ross Nursery?
I think that at that time, it was the mid-90s, and I got a call from a lady associated with St. Vincent de Paul. Her name was Judy Nimblett, and the call was, I need your assistance. We have some children at the Cyril Ross Nursery, Eldorado Road to Napuna, and they need a doctor to see them. I think it was December '94 or somewhere around there. I journeyed up there. I saw about maybe 12 to 15 young children.
What are the age range?
The age range was maybe probably 6 months to 3 years. And that's what I saw at that time. And two of the children were in severe pain. At that time, there was no antiretroviral access in terms of medications. So the focus was comfort care. And that led me to, prescribe or administer pain medications to make these children comfortable. And that inspired me to know I had to answer the call, that this void was created with some expertise in HIV, but limited resources to do the best I can.
Was it pretty rampant around? HIV was rampant, not only with the children, but...
Yes, it was. And then at that time, the stigma was very pervasive. And access to testing was a stigma. Access to treatment didn't exist for children. And sporadically exists for adults, not in a comprehensive manner. So we had a fair set of challenges, and that memory I had in those early days was actually, on average, twice a month, sometimes 3 times a month, going up, almost on a weekly basis, to pronounce some young child that is deceased.
What was the fear for you at that time? Because it's rampant and you're going in to deal with...
My fear for me was be careful. Do the right thing in terms of if you have to administer or inject anyone, in terms of universal protection or precautions. So I didn't have any fear for myself, but I had the fear for the other people on my team. These were caregivers, and a caregiver at that time would have it's basically a caregiver, maybe a domestic worker who decided to come and volunteer. So they wouldn't have medically trained. So my biggest challenge was to help them with their medical training so that they can protect themselves while I went about my work.
Focus on the other, that's how you've lived your life.
Yeah.
Can you tell us more about your work with Wendy Fitzwilliam and about bringing the antiretroviral treatments to those children?
Yeah, Wendy and I struck up a friendship even before she entered the Miss Universe contest. And she sort of was a patron of the Cyril Ross Nursery. And at that time, we had an organization in the United States called AIDS for AIDS. And what that organization did was took medicines or gathered medicines from people who were on medicines, HIV antiretrovirals, and they distribute it to people in need through doctors and through providers. So I made contact with a gentleman there while I was dialoguing with Wendy. How do we get some help to these children? And I think that maybe between 96 and 97, we got some drugs to Trinidad. And with a lot of research on my end, we started to administer to the children. Now, it was difficult even to bring in medicine at that time because medicines had to be approved by our local FDA. And in many cases, they were dragging their feet on approval of these antiretrovirals. Again, that's part of the stigma that existed at that time. So we had to use some conventional means and some unconventional means
Right.
to get the medicines in Trinidad, and we did.
So I have to ask you now, which country was more in tune with you getting, or the medicines? Which country did it come from?
United States, and again through the AIDS for AIDS Foundation, who basically collected people's medicines. If they switched medicines, they would take up the supply.
Right.
And so that's how we did it. And when they partnered with me to get that medicine to Trinidad.
Right. What challenges do you face in providing primary and preventive care to patients in a federally qualified health clinic?
I think the challenge we face is education. Educating the patients in terms of what the objective is, in terms of screening services, and what preventive medicine is about and how it's important. I think that's the biggest challenge.
How do you ensure that the highest level of medical care is provided at Gotham Health?
I think by following the guidelines. So the guidelines are changing and keeping up to date with what's current. That's how I ensure.
How do you keep up to date? What do you do?
Continue medical education.
So
I do that annually. So 5 days a year, or 1 week in a year, I would do my family medicine certification.
Right.
And 3 continuous days a year, I would do my HIV updates.
Wow. What are your goals for the future of healthcare in Brooklyn?
Well, we have our challenges, particularly now that there's more immigration, and the immigrants have their own health issues. There's a gap in terms of, again, health education and access. So the immigrants come from countries that are probably not well served in terms of access to healthcare and access to the medicines that are available. So there's a lot of work to do. But again, health education comes back as a main focus to get people to understand the importance of screenings.
Have you seen healthcare disparities impact the communities you serve?
Regularly.
How do they show themselves?
Well, while it's a constant work in progress, and I'm proud to work with an organization that puts that as the number one thing in terms of focusing on eliminating or neutralizing healthcare disparities. But you have healthcare disparities in terms of access to care. You have healthcare disparities in terms of differential treatment plans that goes to different sets of the population, and access to specialty services. So that secondarily impacts health outcomes. So again, the best care and the best health outcomes come from providers that serve people, or people who are linked with providers who look like them and talk like them.
Amen. How do you balance your administrative duties of being the director, with your commitment to your patient care?
Well, it's something that I...
Because you're a pretty busy person in terms of, you're professional.
Yeah, it's busy, but over the years, it's always a work in progress. You always have to either postpone something or sometimes change the plan to accommodate something else that has popped up. But this is the life we live, and it's a big part of the mission. You really have to be committed, and you really have to have a sense of mission. But it's difficult.
What message would you like to share with the community about the importance of preventative medicine?
I think in terms of the message center is that find yourself a primary care provider, a PCP, and work with your PCP to attend all your health screenings at the required age. So you're talking primarily men and women. You know, you're talking about prostate screening, you're talking about mammograms, you're talking about cervical cancer screening for women's health, and you're talking about appropriate vaccinations that are age appropriate. I think there's a gap in terms of people not understanding the importance of preventive screenings.
How do you see filling that gap?
Provide education and having more people who look like the community they serve to be engaged in what they do.
Key. How important is the language in the medical sphere to be able to do what you just said needs to be done?
Yes, so that is so important because, you know, in Brooklyn we have our fair share of mix. You can walk from one block to another and see Jamaicans, Trinidadians, but you can see somebody from Ecuador, you can see somebody from Puerto Rico, you can see someone from Guatemala. So then you have, you can see somebody from the Congo. Mm-hmm. So, I mean, all of that happens in Brooklyn. Very interesting place. But what we do at my health center is we have several options for translation services. And you speak to the person in their primary language they desire. So that may be Spanish, it may be French, it may be Haitian Creole, or any other language that may be in the Asian sphere of things. So these translator services are very remote, include remote video interpreters. So a live interpreter comes on by a press of a button, and they speak in the language that you choose. The patient speaks. So I speak in English, that's translated to the patient translates to the interpreter in their native language, and there gets the accuracy of message. And these interpreters are specially trained medically as medical interpreters.
So are you finding more interpreters coming into the, being used in the business now?
Yes, absolutely. More interpretations, you know, as a matter of fact, you know, just on Thursday last, I had to wait about 5 minutes to get an interpreter, which normally will come on in 30 seconds, just because the interpreter services are so busy. Yeah.
How's the impact of trust? You spoke about education, but equity in treatment.
Trust is a big area that you have to build trust, you have to earn trust, and you have to work on it. But again, if you look like the people you serve, there's an accepted trust level that comes to that relationship. And the converse is true. If there's a disparity in the provider and the patient, there's a certain level of distrust that comes to the beginning of that relationship that has to be built. So my work in the community is challenging, but it comes to even more challenging for other providers who may not represent the community.
Are you finding that there are more, because you know, the diversity is important, right? Are you finding more diverse doctors who have the mission and the vision to work within that sphere?
I'm seeing more of it, but clearly not enough. There are big gaps. Again, the issue is that the medical profession, there's money and mission. You can't have mission without money, but it's challenging to toggle both. And that comes with some experience and serious commitment to commit yourself to mission But it's important to say you can't have a mission without money.
Remember, this episode is brought to you by our J. Andre Laveau, Consulate General of Trinidad and Tobago, NYC. Like, share, subscribe, donate, check our members page. And leave a comment. Leave a comment on our YT page, which is at On The Call Podcast 20. So, part 2, Dr. H.A. John. H.A. stands for?
Henry Ainsley.
Very cool. Brings me back to my childhood, a school friend. So how did your experience in Trinidad shape your approach to healthcare?
Well, I remember sometime when I was at the University of the West Indies, I got acutely ill. And I had a relatively prolonged hospital stay at the Portsmouth General Hospital. And I think that hospitalization led me to see things that remain with me up to today. So I saw that my family visited me daily. I saw people who did not get visits for weeks on end. But I also saw focused attention on me because of who my family knew or who my family were connected to. So that woke me up to a clear disparity in terms of, well, I'm seeing when I ring the bell to call the nurse responds. When somebody else rings the bell, they may not respond as quickly or efficiently. So that woke me up to some real differences. That's what's happening. And I think during that hospitalization, I said, I need to have some balance and have some input to equitizing this or correcting this in my own way. And at that time, that decision was made for a journey in medical career in medicine.
So, and prior to that, where were you leaning?
Well, I think if I didn't have that hospitalization, I think I may have turned into law, a different way of advocating for others, because I always had a passion of social justice, advocacy. And I think maybe as a lawyer you can have the rich folks pay, and you could probably do some pro bono work for those who are disenfranchised. So you could mix mission and money in a more balanced way. So I mean that was probably my focus before that clear medical experience.
What led you to focus in on adolescent healthcare and mental health substance?
Something is that one of my focuses obviously clearly was an interest in HIV/AIDS, and that came out of personal experiences with a couple of family members who may at that time was affected. But that had associated so much stigma that along the way I also saw stigmas in terms of mental health screenings and people who had to deal with mental health challenges. So I clearly had an interest in that. There was a clear disparity, a clear void, and the stigma that came in mental health parallels the stigma in many ways of what came with HIV. And I think for adolescent care, adults are hard to come to the table. They're hard to care for because, you're young. You want to see a doctor only when something is wrong. And that's just generally goes through more adolescence. But I think the thing about adolescents is now we have a lot of preventive vaccines. So even if you get them in for their preventive care, but you have to talk to them in a language you can get them. So those were areas that had gaps, and those were clear areas of disparities, and there goes my interest.
Could you describe your 2020 experience with COVID?
Yeah, I could. "16 to 20-hour days." I remember at that time I was chief medical officer at Gotham Health. And the focus was on setting up testing sites. So it involved daily work, involved daily planning, involved long hours. And while we were testing, there were folks in the community who were dying. So that was really an awakening time for me. Very tiresome, but very energized to do work that was needed. So we were set up, I assisted in setting up testing sites in all 5 boroughs at that time. But also getting people to do a test before, so you can catch them in the early stage of the COVID disease instead of a late entry. And at that time, people who died were people who entered the healthcare system late. It was too late to save them. So testing was very important.
How was because the level of fear was also pretty high on all around, right? So how was that for you personally, and how you saw it on not only your patients but also your
Providers.
yeah.
You know, I'll tell you personally, I have to thank my God, good Lord and God, because I have been into multiple testing sites. I've seen ill patients. I have seen people who I later found out were COVID positive that I attended to. So that's a constant fear. But I think the most dramatic thing for me in the year 20 to 21 was the loss of some colleagues of mine who worked alongside me. And that was very painful. And in some cases, these were people who reported to me. So 2020, 21 was not really good years in my life. Painful years, traumatic years, but the work needed to get done.
How would you compare that with the time, the rampancy of HIV and what you had to go in to deal with?
In a similar vein, but this was a sort of fast-track approach. HIV, you take some time to contract it, you take some time to move from HIV to AIDS, so there's a window. With COVID, you didn't have that kind of time. You could be infected this week, you'd be dead in 3 weeks. HIV was not like that. So you saw things in real time as a moving fast pace. And when one colleague was down, maybe in a month or so you lost another colleague who worked alongside you. That's difficult.
What is your scope of responsibilities as in the position you hold now? It seems so vast for me when I think about what you do.
Currently, I'm director of OHS, which is Occupational Health Services, and HIV services. HIV is where we, you want to make sure if somebody wants to be screened, it's available. So it's not you come back tomorrow. If you're up to be screened today, that test should be offered today. So it's a big responsibility, but we have come so far with HIV. My responsibility is to ensure that the standard of care that we offer is standardized through the entire system. So you eliminate disparities. And access to medicines and access to testing is on demand. That's my big responsibility. As far as the OHS is concerned, those services were initially provided by the main hospitals. What my responsibility is take that responsibility taken from the big hospitals to bring it within Gotham Health. And that's what I'm trying to create and in the process of building a Gotham Health OHS service.
How is it going?
It's coming along fine. I mean, we have 2 locations, one in Fort Greene that's active, and we have one in East New York that's active. We have one in Manhattan that's active. And there probably maybe 1 or 2 more, one in the Bronx to come up, and maybe one in Queens. So it's a work in progress, but we started from ground zero. So I think we have done well, but there's work to be done.
Okay. Do you still go to Trinidad every 6 to 8 weeks to work on the clinic? The Saturday, Sunday schedule?
No.
No?
That period of my life is over. I did that for close to 20 or 25 years. And
So you get on a plane on a Friday night, get down there.
I get on a plane on Friday night, do a Saturday comprehensive clinic from 8 o'clock in the morning until probably 6 p.m. in the evening. Probably have dinner with friend or family Saturday night.
Right.
And I would take a red eye on the Sunday night, land in the morning, get home, take a shower, and go to work. Yep, that's the routine.
How do you advocate for equality for the underprivileged in the healthcare system? What are the steps do you take?
I advocate for inclusion at the table of decision making. So even my role as CMO was one such thing. If there's disparities were not there that exist, have existed and continue to exist, there would have been no big desire for me to take the chief medical officer role. But the desire to take it was the understanding of the barriers we face and the challenges we face. And people that look like me need to be represented in the leadership level. So advocacy is something with strategic thinking and strategic networking. You can't be everywhere.
Right. But how do you do that networking? I mean, you're busy upgrading the different hospitals. You're busy, how do you take...
Well, I'm involved in the Caribbean Women's Health Association. That's an organization that has been around for so many years, decades. And I've been a board member there since 2009. My commitment to that board and my commitment to ensuring that the services that we offer are known in the community so people can access the service. I take that responsibility very seriously as a board member. And there are like Trinidadians like me who are on that board. And, one will share the other. What is coming up, what's it from, what we need to be represented at. So if I can't go, one of my colleagues may go and come back with the information. But representation is important in forums that deal with decision making or impact the decisions we make.
Well, folks, you heard it. This is Dr. David H.A. John, who is on the mission, all right? Has a vision, and he's not stepped away from that vision one iota from what I hear, from what I've read. So I want to say to Dr. H.A. John, I just like saying it. I get into these things. I want to say thank you very, very much for allowing us this time. Allow us into your head, right? Allow us into the way that you work and the focus the drive that you have with the focus that you've been on all these years. And for hanging in for the next set, for you donating members to get with us inside the call next to the questions. I appreciate that.
It's my pleasure.
In the meantime, audience, thanks for spending your precious time with us. Thank you to Cheese and the OTC team. And don't forget to follow, like, subscribe, donate, check the members page. And remember, when you're on your beat, stay on the sunny side of the street safely. Be health conscious, kind to one another. And don't forget to give thanks for the little and big gifts as we strive to live this beautiful life. And on to the members page.